but I want to make sure that we get to our very last project. Certainly did not leave them to the end because they are unimportant. I want to ensure that we all get to hear what Inclusion Selkirk has been up to. So I'm going to move us forward there.
Hi, I'll just share my screen. There we go. Did that work? Can you see that?
Yeah,
We can see that.
So we thank you to Abilities for providing us the funding to do the project. And what we did was called the Interlake Community of Practice, which was a partnership initiative looking at doing better together. Why did we choose to do this project? Really, our work started a year before the grant came out, where we were asked by another agency and CLDS together to come out and provide some support to an agency within a small rural community. And during that year of work, we had a very solution-focused year working on helping build capacity and resolve some of the issues, and developed a really good relationship with the agency. And at the end of it, we decided that we both really benefited from having that time together. And leaving that table was kind of getting sad. We were like, we don't want this to end. And then the Innovation Fund call for proposals came out. So we decided to formalize what we had been doing and develop this as our thought. So our deliverables were to design and implement a community of practice in the Interlake, to develop training modules identified by we call ourselves the ICP table, to design and implement a community engagement strategy for ICP with a focus on meaningful work and community connections, to look at some board development, and to develop and implement of some shared data collection, because we felt that's something that's really missing in our sector. So when I look at what we did next, we followed the guiding principle of, in any world where you can be anything, be kind. And that is what we had done for the year prior, sitting at a table where we shared honestly and openly all the good, the bad, and the ugly. And we learned from each other. We gave what we could each give, knowing that sometimes you'd have to give more, and sometimes you would receive more, but walking away knowing that what we were doing was to build capacity in the sector as a whole. And sometimes we have to give to make that happen. The model we have for our community of practice is we meet weekly as operators. So that's agencies that are at the table come together every Thursday. We then have an advisory group that meets every 4 weeks. That advisory group included our operators plus Abilities Manitoba. So Margot would come to the table, and our CLDS program manager. We hired a consultant with the grant because there was a lot of work that we knew needed to be done. And the consultant then did some of that background work that we weren't able to achieve if we were just doing it with our staff. And our operators create the agenda for our advisory meetings, and we provide time for our CLDS to do the updates on things that are happening with them. But it gives us a really good place to sit together and talk about what are the issues we're having from a CLDS perspective as agencies. When I look at the development of training modules, we managed to identify that what training currently exists within the province or online. We created a sheet with known training, and that's been shared with our table and the resources links for people. We identified as a group what we felt the training was required for staff and at what intervals training would happen. Then we developed a schedule of that required training, and we looked at optional training and when to provide it. So what we are finding is the 3 agencies that are working together are now orientating staff in a similar way, or there's 4 agencies now in a similar way and working at those things. We developed training modules because we didn't have training available for trauma-informed care or vicarious trauma and self-harm. We didn't have anything that we could do our own training on. So we've now developed training modules and have a train the trainer kind of methodology that works for the group. Our deliverable to design and implement the community engagement strategy for ICP. We achieved that through 2 of the agencies had a full community engagement. We did interviews with staff, people served and supported, board, community at large, families. And we brought back the lessons learned from those to the ICP table as a whole. Our board development, 2 of our boards have completed the full Elevate training, which is run through SARC. 3 boards have attended shared training days. So we crafted and created an intro to the service purchase agreement session, and we developed and delivered that to 3 of the boards. 3 of our board of directors are now using board work plans. 2 of the boards have completed self-assessments and implemented strategies to address areas needing improvement. 2 of the boards have reviewed and updated bylaws, and 2 boards have reviewed and updated policies and procedures specifically to bring them to a governance model. Everything was developed in a template format, so it can be customized by the next person looking at it. And that's been a really good format for us. I'll talk a little bit about that after. And our board orientation manual was developed and has been done in another templated fashion, so it can be customized and used by other people at the table so that it works specifically for their organization. Around data collection, we developed a pilot survey to capture full-time equivalent staffing information from the agencies involved. What we found is that every agency categorizes their staffing differently, schedules differently, has a different understanding of what their FTE is. So it took us a few tries to get consistent captured data. 4 agencies did complete the final survey, and it does provide us with a good baseline of FTEs and vacancies. It also shared impacts of what staffing shortages have done and the impact that's had on the quality of services and quality of life for people. That probably tells a bigger story than anything. Then when I look at what we did above and beyond the deliverables, so we shared a ton of resources, communication tools for wage announcements, accessibility, legislation compliance, everything. So there's, as a larger organization at the table, we have a larger staffing complement. We have been able to take a lot of the documents we already use and create them into templates and help the other agencies develop templates and action plans to become compliant with legislation requirements and things that they may not have had access to before. Capacity building, so we share resources such as OT and nursing services. We've shared support plan templates, provided training to the new management team when they hired people. Within agency relations, we connected agency management teams. So it's not at the table, it's executive directors, but we now have management that are connected on other levels. And they are sharing resources, calling each other for guidance, gives them a safe space to ask questions, to work through issues. As for agency resources, we've fully redrafted agency policy manual, and we've fully redrafted our agency procedure manual, and then crafted those into templates that could be used by the other agencies at the table together. We did business continuity planning, and we worked to create a template that would work in our sector, because every template we found did not work. You could use a piece of this and a piece of that. So we've now crafted our own template. and shared training resources. So our staff have provided training in other alternate agencies. We supported a train the trainer model. So if we have a staff who can do training, they can go out and train another staff in the other agencies to provide that same training so that they have their own capacity then. Training modules have been adapted and shared from agency to agency. And we've also provided some shared opportunities for management teams where we've done the training days together and shared both the cost and resources. What we've learned is that relationships are key. So we're working in the rural communities in the Interlake, and we're finding that executive directors are extremely isolated. Having a table to share with reduces stress and isolation. Having a space to ask the questions without judgment is important. Learning from others' mistakes helps us all improve. And to make this work at an ICP level, we have to be willing to be vulnerable and open to improvement. If we go in thinking we know it all, then nobody really gains. If we go in knowing that as we share, we'll learn and we all need to change and adapt, then we grow together. Board development is really important. And I think bringing our boards together provided an amazing opportunity for growth and development. We've recognized that many board members do not have a clear understanding of their responsibilities and their liability. They understand that their community needs services and they've joined the board because they believe in it, but they do not understand what their role is as a board member. Educating the board creates work, but increases accountability. So an educated board asks way more questions and challenges us as EDs way more, but at the same time, it makes the accountability that much better for everyone. It creates space and time. So coming together weekly allowed us to create the space and time to get work completed that gets shuffled to the bottom of the pile all the time. Coming together helped us prioritize items as a group. So while we may have had 20 things we wanted to work on, we would pull what was the most imminent for all of us at that time. Sometimes it was based on the fact that all three of us were struggling with the same issue, or sometimes one of the agencies was really struggling and we all felt that it was better to focus on that priority to help them along than it was to focus on the things that were lower down our priority list. So it was really a lot of give and take and a willingness to put in time and energy and share resources. We've learned that service providers and government relations are really important. So reviewing issues as a group helped us find middle ground or a better understanding of why. Having government at the table, we sometimes had to agree to disagree on things, but we also learned from government and helped us understand things sometimes differently. And having the person at the table where you can ask the stupid questions and they'll provide you with the answer without judgment was really helpful. Barriers and risks. Time commitment for the executive directors is a challenge. We mitigated that by hiring the third-party consultant to lead and do some of the work, and the larger agencies shared resources and helped to get some of the work done. And our next steps, we have applied for and received a grant to allow the work to continue for another year. Our goal is to continue to grow the ICP table and to continue to share resources and information on what worked with people that are interested.